Good afternoon, everyone. I am Dr. Mahashweta Malik, Assistant Professor Pathology, NMCH Patna. Today we will discuss about viral hepatitis. Hepatitis is the inflammation of the liver. Hepatitis, it can be caused due to many things. It can be either due to toxin, drugs, or it can be due to autoimmune disease, but virus is the main cause of hepatitis. So, we will discuss mainly about the viral hepatitis. Viral hepatitis can be caused by various types of viruses. These viruses cause systemic infection and it also causes hepatitis, such as Epstein-Barr virus. It causes infectious mononucleosis, cytomegalovirus, yellow fever, rubella virus, adenovirus, herpes virus. All these causes viral hepatitis along with systemic infection. But there are some virus which are specifically affects the liver. These are known as the hepatotropic virus or hepatitis virus. They have a special affinity for the liver. We will discuss mainly about these viruses, the hepatitis virus or the hepatotropic virus. They are mainly of 6 types: hepatitis A virus, B virus, C virus, D virus, E virus and G virus. Very little is known about the G virus, but the rest of the virus has been well studied and we will discuss about those. Except hepatitis B virus, all the other viruses are the RNA virus. Hepatitis B virus is the only DNA virus. Hepatitis A and E virus are transmitted by fecal-oral route. B, C and D, they are transmitted through parental or sexual route. Now we will talk about hepatitis A virus. Hepatitis A virus is also known as infectious hepatitis. 20 to 25% of the hepatitis is caused by this hepatitis A virus. This causes a benign self-limiting disease. Its incubation period is 15 to 45 days and it mainly affects age group 5 to 14 years. When this occurs in adult, it has got a more dangerous course than when it affects the children. Its spread is mainly by the fecal-oral route. It is clinically asymptomatic or there may be mild symptoms. Occasionally throughout the world this occurs, mainly in the developing country where there is poor hygiene. This hepatitis A virus does not have any chronic hepatitis stage or carrier stage. This virus is a small non-enveloped virus. It consists of a single-stranded RNA. It is a picorna virus and it has got a icosahedral capsid which is 27 nanometer in diameter. It is present in stool, bile and blood and it is excreted in the stool 2 to 3 weeks before and 1 week after the occurrence of jaundice. It is a very labile virus and it is easily inactivated by boiling for 1 minute or by ultraviolet radiation or by formaldehyde or chlorine. In 25% of the cases, it converts to acute hepatitis. Its fatality rate is low, only 0.1% gets converted to fulminant hepatitis. This is a graph showing the presence of the antibody of the virus. IgG, it is present and IgM is present. IgM appears earlier than the IgG and its fecal excretion of the virus occurs. This is shown by the red graph. Even before the appearance of jaundice, fecal excretion of the virus occurs. Hepatitis A virus produces 2 types of antibodies, IgM, which indicates acute infection, and fecal shedding of the virus ends, then this IgM appears. Then IgG, it is present for the whole life. If one person gets infected by hepatitis A virus, then IgG is present for the whole life. This gives a protective immunity. Now about hepatitis B virus. This is known as serum hepatitis. Hepatitis B virus can cause acute hepatitis, can cause non-progressive chronic hepatitis, can cause progressive chronic hepatitis, can cause fulminant hepatitis, can be asymptomatic carrier state, can cause hepatitis D viral infection on top of it, or it can also cause hepatocellular carcinoma. Global problem of hepatitis B virus is that 300 million carriers are found all over the world. Its incubation period is 30 to 180 days. This virus persists in all the physiological and pathological body fluid. Physiological body fluid such as in sweat, breast milk, urine, and pathological body fluid such as peritoneal fluid, pericardial fluid, except in stool. It is not present in stool, such as just as hepatitis A virus, which is present in stool, but hepatitis B virus is not present in stool. Transmission of hepatitis B virus is mainly through the blood and blood product, through body fluids such as semen, saliva, sweat, tears, breast milk, pathological effusion such as peritoneal effusion, pleural effusion, through dialysis, through needle stick accident, through intravenous drug abuse, through homosexual activities, and if a neonate gets infected, becomes a carrier for life. The hepatitis B virus belongs to a family of Hep adenovirus. It is a DNA virus. It infects other species other than human also. Electron microscope shows two type of particles, small particles and large particle. Small particles are spherules and tubules, which are mainly the envelope of the virus. Large particle are the core particle, also known as the Dane particle, which is the main virion. Its genome is a partially double-stranded circular DNA molecule. This is the picture showing the virion. Its center black is the DNA of the virus, which is a circular double-stranded DNA. This is the only DNA hepatitis virus. Then the yellow is the DNA polymerase. It is covered by core protein. The light blue is the core protein and the green one is the surface protein. Hepatitis B virus genome has got many types of gene, mainly 4 types of gene. S gene codes for the envelope protein, P gene codes for the DNA polymerase, C gene codes for the capsule. There are 2 types of nucleocapsid protein, HBeAg and HBcAg. There is X gene which codes for the HbX antigen. This X antigen is responsible for transcription of the viral and cellular gene. It is also the causes carcinogenesis by binding with the P53 and regulating its degradation and expression. P53 gene is the tumor suppressor gene. Whenever there is a damage to the DNA of a cell, this P53 gene arrests the cell in its G1 phase, doesn't allow the cell to undergo mitosis, tries to repair the damage of the DNA, and if it is not able to repair the damage, it causes apoptosis of the cell. So this is the function of the P53 gene. But this function is, there is degradation of the P53 gene resulting in not suppression of the tumor cells, and that results in causation of carcinogenesis. Now this is the double-stranded DNA. The light blue it is the DNA polymerase. Then red one is the core protein, X gene is the green one, and the surface gene is the pink one. Now the serum viral markers of hepatitis B virus. The hepatitis B virus have got different types of antigen and its corresponding antibodies. First antigen is the HBs antigen or the surface antigen. It is also known as the Australia antigen because it was first discovered in Australian Aboriginal. Hepatitis B surface antigen, this appears in the blood 6 weeks after 6 weeks of infection. It indicates active hepatitis B viral infection. It disappears in 3 to 6 months. But if it persists for more than 6 months, then it is the patient is said to have gone into a carrier state. Its corresponding antigen is the anti-HBs. This is the antibody of the surface antigen. It appears 3 months after the infection. This antibody is of two types, IgM and IgG. Its presence prevents reinfection. Now, the second antigen is the HBe antigen. This is the core protein. It is present between 3 to 6 weeks of infection. This indicates acute phase. If it is present more than 10 weeks of infection, then it is said to be a chronic carrier phase. Antibody of this antigen is anti-HBe. It appears after the disappearance of the antigen. HBe antigen disappears, then its antibody anti-HBe appears. This indicates resolution, that the patient is healing. Now the third antigen is HBc antigen. This is not detected in blood because it is present only in the nuclei of the hepatocyte. Anti-HBc is the antibody of this antigen. This is present in the blood. It is of two types, IgM and IgG. This appears even in the pre-icteric phase. IgM persists for 4 to 6 months, then IgG appears. Now the DNA of the virus, it can be detected by the Southern blot technique. Southern was a scientist who discovered this technique, so it has been named after him, the Southern blot technique. This is the most sensitive indicator because it can detect the presence of the virus even in the pre-symptomatic phase. Now hepatitis B viral infection have got two phases of infection. One is the proliferative phase and the second one is the integrative phase. In the proliferative phase, the viral DNA is formed, has got an episomal form. It is present in the cytoplasm independently from the host DNA. So it is present in the cytoplasm in its own, and it causes replication of the virus, forming surface antigen, core antigen, and this is presented to the CD8 cell of the host, which causes destruction of the hepatocyte that is infected by the virus. So the destruction of the liver cells in the host is due to the host immune response, not to the virus itself. Virus causes replication in the hepatocytes but does not cause its destruction. Destruction is by the CD8 cell, which detects the presence of the antigen of the virus and cause destruction of the hepatocyte. Then the second phase is the integrative phase, in which the viral DNA gets incorporated in the host cell, host nucleus. Host gene incorporates the viral gene, and this can result in formation of hepatocellular carcinoma. Hepatitis B virus can have a carrier state when the surface antigen is present for more than 6 months. It can be in a chronic stage with liver damage, where there can be persistence of is the surface antigen, the core antigen, and the presence of the DNA and its antibodies. It causes progressive liver disease. Now that was all about hepatitis B virus. Now hepatitis C virus. It is present worldwide. It was earlier called non-A, non-B virus. Its transmission is mainly through blood transfusion. 90 to 95% transmission is through blood transfusion. It can be also transmitted through inoculation. It can be transmitted through sexual route, both heterosexual and homosexual route, or there can be vertical transmission also. Its incubation period is 20 to 40 days. It causes chronic hepatitis, cirrhosis, and hepatocellular carcinoma. This virus is of family Flavivirae. It is a enveloped single-stranded RNA virus. Its genome is a single polypeptide. Its genome is unstable, so multiple types of virus can be seen. Due to this instability of its genome, a vaccine for this virus is difficult to be produced because it converts into multiple type of virus. Its antibody, anti-HBV, does not provide effective immunity because of its multiple form. The serum marker of this virus, it has got 3 generations of antibody depending upon its time of appearance in the blood. First generation is antibody against C103 region of the protein. This appears 1 to 3 months after infection. Second generation is antibody against C200 and C33C protein. This appears 1 month before the first generation. Third generation is antibody against the C22-3 and NS5 region. This appears earlier than the second generation of antibodies. So there are the earliest appearing antibody is the third generation, then the second generation, then is the first generation of antibody. Its RNA can also be detected by the PCR technique. This is the RNA of the RNA genome of the virus of hepatitis C. It has got 5' to 3' terminal strand, and different areas produces different antigens. So the earliest and the first generation antigen is the C103, then the second generation antigen is the C33C, and the third generation antigen is the C22-3 and NS5. Now about the hepatitis D virus. This is also known as the delta agent or hepatitis delta virus. This is a defective RNA virus. It does not has an envelope. It can be infective only when it has got the and it gets encapsulated by the surface antigen of the hepatitis B virus. Hepatitis B virus surface antigen provides the envelope for this virus, then only it can replicate. This hepatitis virus, therefore, infection occurs only in presence of the hepatitis B viral infection. This infection can be in two settings. There can be co-infection or there can be super-infection. Co-infection is when hepatitis B virus and hepatitis D virus both together infects a host. Then it is said to be co-infection. Here the infection is mild type. And super-infection is when a person is already suffering from hepatitis B virus infection. On top of it, he gets infected by the hepatitis D virus. It is said to be super-infection. Then this type of infection is a fulminant type of infection. Hepatitis D virus is seen worldwide, but its prevalence is rate varies. Mainly it is present in Africa and Middle East. 20 to 40% of the carriers shows anti body to the hepatitis D virus. In USA, it is mainly seen in the drug addicts and hemophiliacs. It is not that common in Southeast Asia and China. So, it is rare in Southeast Asia and China. This virus is a small double-celled virus resembling that of the hepatitis B virus, but this is a RNA virus. Hepatitis B virus is a DNA virus. This is a RNA virus. Its RNA can be detected in the blood. Antibody to this IgM can also be detected and can be a reliable marker. Now, hepatitis E virus. Hepatitis E virus is almost similar to the A virus, except that if it occurs in pregnant female, it can have a deadly course. It is transmitted enterically. It is a waterborne virus. It affects young and middle-aged adult. It is mainly present in the Asia and Indian subcontinent, sub-Saharan Africa and Mexico. It's in pregnant women. If this occurs, mortality rate is high, 20% mortality can occur. Normally, it is a self-limiting disease and there is no chronic carrier state of this virus. Hepatitis E virus incubation period is 6 weeks. It is a non-enveloped single-stranded RNA virus. Its antigen HEV antigen is the only protein synthesized. This virus is shed in the stool. Serological marker is IgM. It can be also detected by the clinical illness, increase in the serum transaminase and presence of hepatitis E virus in the stool. Now that was about the different types of hepatitis virus. Now we will discuss about the clinico-pathological syndrome of viral hepatitis. Viral hepatitis can present in different state. It can present as a carrier state without apparent clinical disease or with chronic hepatitis. It can present as asymptomatic infection. It can present as acute hepatitis. It can be present as chronic hepatitis. It can be present without progression to cirrhosis or with progression to cirrhosis, or it can present as fulminant hepatitis. So these are the different forms of presentation of the viral hepatitis. A and E virus does not have a chronic hepatitis or carrier state. Many drugs and toxin can also present as hepatitis. It's serological study. Therefore, serological study is needed to diagnose that it is a viral hepatitis. If viral antigen antibodies are found, then it is said to be viral hepatitis. Otherwise, other causes of hepatitis has to be searched for. Carrier state: an individual is said to be of carrier state if he continues to harbor and transmit the organism without manifestation of the disease. The patient can be a healthy carrier without suffering any adverse effect, or there can be chronic liver disease but the patient is free of disability. It is commonly seen in hepatitis B virus and C virus. B and C have a carrier state. If B or C virus occurs in neonate, then 90 to 95% of the child become a carrier. In adult, only 1 to 10% of the infected individual goes into a carrier state. Acute viral hepatitis, all virus goes into this phase, acute viral hepatitis. All produces similar clinical features. 4 phases can be seen in acute viral hepatitis. There is an incubation period, symptomatic pre-icteric phase, symptomatic icteric phase, and convalescence phase. pre-icteric phase, before the appearance of jaundice. Icterus means yellow discoloration of the sclera is called the icterus. So when this phase is before the discoloration occurs, that is the pre-icteric phase. This is characterized by malaise, fatigability, nausea, loss of appetite, fever, rash and arthralgia, and tender hepatomegaly. Icteric phase, this is characterized by conjugated hyperbilirubinemia, dark colored urine, stool light colored, and there can be pruritus, itching. Lab finding, there is increased bilirubin, increased transaminase, increased alkaline phosphatase, prolonged prothrombin time, and hyperglobinemia. Post-icteric phase, this is the recovery phase. It occurs 2 to 12 weeks after infection. There is clinical and biochemical recovery, except in some cases of hepatitis B and C virus, which may go into a fulminant hepatitis or into a chronic hepatitis phase. Acute viral hepatitis, morphologically, this virus is reaction is shared by the virus and drugs. The changes in the liver can be of different type. In hepatitis B virus, there is a ground glass appearance of the hepatocyte. Ground glass appearance, it gives a eosinophilic type appearance, and this is due to the mainly the hepatitis B surface antigen. The surface electron microscope shows that this surface antigen are of spherules and tubules type, which is present in the cytoplasm of the hepatocyte, giving it a ground glass appearance. There can be sanded nuclei. The core antigen is present in the nucleus of the virus, giving it a sanded appearance. There can be ballooning degeneration. Ballooning degeneration, the cytoplasm, the cell is swollen up and the cytoplasm gives a clearing type of appearance. This is a ballooning degeneration. There can be cholestasis. Cholestasis is obstruction in the biliary flow, causes cholestasis. There can be Councilman bodies. Councilman bodies are the eosinophilic hyaline-like bodies. This is due to the apoptosis of the hepatocyte. When the hepatocytes undergo apoptosis, that is they die out, then it is gives a appearance of eosinophilic appearance, that is known as the Councilman bodies. There can be different type of necrosis in the liver. There can be single cell necrosis or there can be bridging necrosis. Bridging necrosis can be from central vein to central vein, from portal vein to central vein to central vein, from portal triad to portal triad, or from portal triad to central vein. There can be Kupffer cell hypertrophy and hyperplasia, or there can be interface hepatitis. This is a picture in which there is, we can see from the right side, there is ballooning degeneration, there is Kupffer cell hyperplasia, there can be dropout necrosis in which the cell have undergone necrosis, only its outline is remaining. There can be Councilman body or acidophilic body due to the apoptosis of the hepatocyte, and there is inflammatory infiltrate near the portal triad. Now about chronic viral hepatitis. Chronic state is said to be when the disease is present for more than 6 months, then it is said to be has gone into a chronic state. There is symptomatic, biochemical or serological evidence of continuing relapsing hepatic disease for more than 6 months with histologically documented inflammation and necrosis. Then it is said to be chronic viral hepatitis. Chronic viral hepatitis can be due to mainly hepatitis B virus and hepatitis C virus. Other than virus that can cause chronic hepatitis are the Wilson disease, alpha-1 antitrypsin deficiency, chronic alcoholism, drugs such as isoniazid, methyl dopa, methotrexate, or it can be due to autoimmunity. Now, in chronic hepatitis, the changes in the liver, there is inflammation of the portal tracts, there is interface hepatitis, there is bridging necrosis, and there can be fibrosis. The picture A shows the normal liver cell with normal central vein, portal triad, and the radiating cords of hepatocytes. The portal triad is surrounded by a limiting plate. And in the picture B, this is the changes in chronic hepatitis. Here the limiting plate is destroyed. This is interface necrosis, and there is focal necrosis can occur in small areas. There can be necrosis is later replaced by fibrosis. There can be bridging type of fibrosis. Here it shows from central vein to portal triad there is bridging fibrosis, and there is proliferation of the bile ductules, and there is infiltration by the lymphocytes, plasma cell, and macrophages. So these are the changes that can be seen in chronic hepatitis. Now the clinical course of chronic viral hepatitis is unpredictable. It can result in cirrhosis or in hepatocellular carcinoma. Now about fulminant hepatitis. When hepatic insufficiency progresses from onset to symptoms to hepatic encephalopathy within 2 to 3 weeks, then it is said to be fulminant hepatic failure. Means within 2 to 3 weeks from the onset of the disease, it can go to hepatic encephalopathy. Then it is said to be fulminant hepatic failure. It can be, this fulminant hepatitis can be due to hepatitis virus such as A, B, C, and D. A virus only 0.1% goes to fulminant hepatitis. In others, 50 to 65% can go into fulminant hepatitis. Drugs and chemical can also cause fulminant hepatitis such as acetoaminophene, isoniazid, MAO inhibitors, halothane, methyl dopa, mycotoxin. All these can cause fulminant hepatitis. Other causes can be ischemia, hyperthermia, fatty liver of pregnancy. All these can also result in fulminant hepatitis. In fulminant hepatitis, there can be massive or submassive necrosis. In massive necrosis, even the reticulin framework of the liver is destroyed, and in submassive necrosis, the reticulin framework is preserved, so there can be regeneration of the hepatocyte in an orderly fashion. In fulminant hepatitis, the liver is shrunken and red, and the capsule is also wrinkled. Mortality rate of fulminant hepatitis is 25 to 90%. So this was all about the different type of hepatitis virus and the symptoms, syndromes that they can cause. So this was all about it. Thank you. Till we meet again in the next class.